So one thing I wanted to emphasize is how the three big herbal traditions handle symptoms versus root causes, because this is really interesting. So I'm trained from a planetary perspective, meaning I bring in Western herbalism, Ayurveda, and traditional Chinese medicine. Western herbalism, and this is a little bit of a blanket statement because I think within Western herbalism, there's a lot of different opinions and practice styles and things like that. So keep keep that in mind. But when I say Western herbalism, that is the herbalism being practiced in North America and in Europe and just kind of what has taken root and gotten popular. So when I think about Western herbalism mirrors Western medicine in a lot of ways. It is kind of stuck in that same structure. It doesn't have a different assessment method. It is, using kind of Western diagnostic tools, and it can get stuck in use this herb for this symptom, use this herb for this disease. Now, I think you can be a really good Western herbalist and practice that way, but I do think you kind of reach a limit without some other tools or a system of energetics. So Western herbalism is very apt to treat symptoms. Somebody's not sleeping, we give them a sedative. Somebody's tired, we give them a stimulant. Somebody is inflamed, we give them an anti-inflammatory. So Western herbalism in general is totally okay treating symptoms. Your nervous system's out of whack, we're going to give you a nervine. It really does kind of fall the closest to the Western medical model out of all three of the big herbal systems. For right or for wrong, I'm just providing information. So next we have Ayurveda. And Ayurveda is really interesting because while it does address the root cause and what it takes to live a healthy, balanced life, it also treats symptoms. So the very immediate goal of Ayurveda is to get the doshas back into balance. So we know that the doshas are a short code for certain imbalances in the body. And when you come forward or you go see an Ayurvedic practitioner, an Ayurvedic doctor, the goal is to treat the doshas. And it's almost symptomatic treatment because it doesn't care how the doshas got out of balance. It just cares about getting the doshas back into balance. So Ayurveda will treat symptoms. And Ayurvedic treatment truly does go beyond just the doshas, but as a general statement, like it's a fully fledged medical system, and some of the things we do work just to improve symptoms. Some of the things we do are just to get the doshas back into balance. Some of the things we do are more root cause or focused on prevention and longevity. So Ayurveda is an interesting mix of all of these pieces, and I would say it probably mirrors how I work the closest, and I will touch on that in a little bit. And then there's traditional Chinese medicine, which is the least willing to treat symptoms. Chinese medicine really just wants to treat the underlying pattern and expects people to be patient to see results. And so they want you to fix the pattern. And maybe they'll bring in symptomatic treatment occasionally for like sleep because it's so important. They might give you a sleep herb instead of waiting for that pattern to correct, or maybe even something like pain, because leaving people in pain is not necessarily the most compassionate thing to do either. But as a general statement, Chinese medicine doesn't want to treat symptoms. It wants to treat the underlying pattern. Now, treating the underlying pattern, this is the root cause, is the underlying pattern, the reason we're out of balance in the first place, is the most efficient way to work. However, it takes the longest to see results. So this is a challenge with using traditional Chinese medicine on a Western population. We are trained to get quick relief. When we go to a doctor and we take a medication, that medication is very potent. And we feel it quickly. We take a painkiller, we don't have pain. We take a Xanax, we relax. We take a Valium, I think that's a sleep one, then you go to sleep, right? Like Western medicine has big, bold, blunt tools and you feel them. And because that's what most people experience, they expect herbs to work that way. They expect natural healing to work that way. And when it doesn't, and when they don't see quick enough results, they give up on it. and we don't want them to give up on it. So it's this interesting balance to maintain of getting people to stick with their protocols and the work while being patient when we're not trying to be patient. We live in a very instant gratification kind of society. And so when we don't have that instant gratification, we think things aren't working. So traditional Chinese medicine in its, I want to treat the underlying pattern, not the symptom, is the most efficient, but because you don't see quick results, people don't stick with it. And this population really, for the most part, doesn't take to that level of treatment very well.